Hello, good morning, good afternoon, good evening to wherever you're watching in the world, and welcome to the Centre for Universal Health at Chatham House. I'm Robert Yates, I'm Director of the Centre. Today we've launched a new report looking at solidarity in response to the COVID-19 pandemic, and we've invited an eminent international panel to discuss this vital topic of solidarity and the need to have sort of greater solidarity in tackling this pandemic and future pandemics. This research has been kindly supported by the Ministry of Foreign Affairs of the government of Japan. And we decided to pick on this topic because at the beginning of the crisis, there was this great focus on solidarity, recognizing that the pandemic represented a universal threat, threatening the lives of all of us on the planet. And because of its infectious nature, recognizing that no one is safe until everyone is safe, and that to get universal protection requires solidarity. So we've been looking at how successful or otherwise the world has been in showing solidarity in tackling the pandemic. And our report is launched today, and its overall finding is that it has been decidedly mixed. There has been a great solidarity, I think, in some areas, particularly around scientific research and in discovering vaccines. But particularly in 2021, alarming signs of solidarity breaking down, particularly around the distribution and allocation of vaccines, and a real lack of solidarity between countries. But furthermore, a lack of solidarity within countries and certain population groups and parts of society clearly being left behind, which is very concerning. So I very much encourage you to study our report, which is on our website and is easily accessible. But today's meeting is very much to bring together eminent experts from around the world to give their perspectives from different continents and different backgrounds around this issue of solidarity. I should say that today's session is on the record. It's not following the famous Chatham House rule. So please do feel free to tweet this and disseminate the messages as much as like amongst your friends and colleagues. So I will introduce our panel briefly now and hand over to them. But we are very much encouraging you, the audience, to pose your questions to the panel. And we ask you to do that using the Q&A function, not the chat function. If you use the Q&A function, we'll see the questions coming in. And then if you see a particular question that you like, please upvote it using the thumbs up signal. And that way we'll be able to see the most popular questions rise to the top of the list. And being democratic, we'll be most likely to ask those questions. And very much encourage you to come on screen, if you like, to ask your questions of the panel. So do please participate as much as you like. So our panel today, and they'll be speaking in this order. First of all, we have Marai Chatterjee, who is the Director of Social Security at the Self-Employed Women's Association of India, and a great authority on universal health reforms within India. Then we have Professor Kesu Takemi, who is a WHO Goodwill Ambassador for Universal Health Coverage, and he's also a member of the Diet, the House of Councillors of Japan. We then have Mariangela Simão, who's originally from Brazil, and she's the WHO Assistant Director General for Access to Medicines, Vaccines and Pharmaceuticals. So you can imagine she's been very busy over these last 18 months. And finally, we have Professor David Heyman, who is a Distinguished Fellow here at the Global Health Programme at Chatham House and a Professor at the London School of Hygiene and Tropical Medicine. So if I can ask the panel, really, from your perspective, what do you think has been happening vis-a-vis solidarity in this pandemic? You know, where have the successes been? Where have the failures been? And maybe what lessons should we be learning as we prepare for the next pandemic? So Marai, if I can hand over to you first, and if you could speak to us for about 5 minutes on that. Thank you.
Thanks very much, Rob, and thanks to Chatham House, and congratulations on the research paper, which I read with great interest and felt like it resonated not just with me, but all the almost 2 million members of Seva, the kind of experiences we've been going through in the first wave and second wave. So where has solidarity succeeded? I would like to start with the local level, with local people. In my experience, communities like village communities, urban neighborhoods of all kinds, across classes, in fact, but my experience is more with informal workers at the micro level, grassroots level. We saw tremendous amount of compassion, humanity, and solidarity. I think, especially where trust and solidarity already existed, not to say that others didn't, but wherever there were already cooperatives, women's self help groups, farmers' organizations, youth clubs, we saw the way people dropped everything and rushed to support each other. If I speak of my Seva sisters, their husbands and family members said absolutely no stepping out of the home, and they defied them and they went and served other people before themselves. Civil society, of course, NGOs, and again, I know the Indian situation best, right from the time where all of you would have seen on the media those heartrending scenes of migrant workers trudging thousands of kilometers back to their home villages. All along the route, NGOs and civil society people were feeding them, providing medical equipment, and so on. I'd also like to mention some communities and religious groups like the Sikh community in India, who have a concept called langar, where it's a very egalitarian concept. They feed anybody and everybody 24/7, any time of year. And they used this concept and had oxygen langars, where anyone could go and be hooked up to life-saving oxygen. So there are really amazing and remarkable examples of solidarity. Also, the international cooperative movement. I would like to mention the UK cooperative movement, which rose to the occasion, and little cooperatives in the UK supported as best as they could. Obviously, some governments and local authorities also kicked in. I mean, governments also have to take the lead in solidarity with their people and set the tone, I believe. So there were examples of that in many states in India, and in our experience, particularly local authorities, with whom already we had a good rapport. And I think people showed leadership at different levels, and that has to be said, and we have to be fair. While we often talk of leadership failure, there was also local leadership, and people did rise to the occasion. I think where we failed has been brought out very well in the reports. I don't want to dwell too much on it, but I think, as you mentioned, between countries, the whole issue of intellectual property and vaccines. And, I'm from India, and India, along with South Africa, was one of the countries, or is one of the countries, sort of pushing for this. Vaccine inequities of all kinds. In India, we saw those who were richer people who could afford from private hospitals rushed and got themselves vaccinated, and still large swathes of the country, particularly rural areas, are not vaccinated. Quickly, some prospects for solidarity. I firmly believe from our experience at Seva and also working with other organizations that solidarity has to be nurtured in peacetime, if I may say so, or normal time. It can't just come overnight like that. And I think an important part of nurturing solidarity is promoting collectivization, mobilizing communities, self-help groups, cooperatives, and particularly organizing on livelihood, because this is critical for most of all of us, in fact, and certainly for most of the developing world where most are informal workers. So that will hold us in good stead. Hopefully, there won't be future waves, but for future waves and future pandemics. Another quick lesson, start local. We have so many examples of excellent local action. Let us learn from these, highlight some of these, maybe in a next research report. And maybe that will spur our leaders and the rest of us into action, particularly traditional communities for whom solidarity seems to be in their very DNA. And just to conclude, I think the idea that is mentioned in the research paper on the platform for a quick response based on principles of solidarity and equity, and I would add voice and representation, particularly of those whose voices we don't normally hear, including membership-based organizations, cooperatives, women's groups, NGOs. And I hope not just at the global level, but also we could try this at our national and subnational regional levels. Thank you very much.
Excellent and perfect timing, Meraida. And I think particularly great you mentioned that local solidarity. I think this is something that we've seen at all income levels, rich and poor countries alike. And I think the very important point you make about the needing to nurture solidarity during peacetime. And I think it was very much one of our feelings that it was very unfortunate. I think the pandemic came along when sort of solidarity was at a pretty low ebb, really, internationally. And the one looks at particularly at maybe the actions of former President Trump, undermining that. But so there were national tensions already and a lack of solidarity. So this really sort of undermined the whole process. Now, if I can turn to Keizo Takemi in Tokyo, preparing for the Olympics and obviously extremely busy there. Keizo, what's been your perspective, both from Japan, but also as a UHC Goodwill Ambassador for WHO?
Yes. Anyway, thank you very much indeed. It's a great honor to be here today with the distinguished panelists and the audience. Well, there is no doubt that the stronger solidarity is needed in response to the future pandemic. And I would like to offer my thoughts on three of the perspectives that suggested by the report, the solidarity in response to the COVID-19 pandemic. The first, I would like to point out that solidarity at the international political level was the weakest and the most vulnerable element in the response to the recent coronavirus outbreak, unfortunately. It is interesting to analyze that existing international tensions and competition, such as the US-China conflict, hindered solidarity's actions, and that existing multilateral institutions did not function well. In fact, it has been a challenge to ensure an appropriate balance between infectious disease control and economic activities at the national and the global levels. The border control, export restrictions, and intellectual property sharing were also issued. In this regard, I would like to suggest three approaches. That the first, the strengthening the global health, the governance reform, and second, formulating a legal framework such as the Framework Convention on the Tobacco Control. And third, establishing the new combination of different disciplines such as epidemiological economy, important to promote solidarity. From these perspectives, it is necessary to delve into how and why the G7 and G20 frameworks and the inter-regional networks functioned or did not function this time, and to build consensus on the international response. And second, according to this report, the COVID-19 has contributed to the expansion of social disparities in health, as well as the social networks, social capital, and the community support have strengthened the solidarity. In this regard, Japan has long been emphasizing the concept of human security, reported as the Human Security Now in 2003. Then in 2012, the UN General Assembly adopted a resolution on a common understanding of human security by consensus, which emphasizes policies and measures to ensure that, quote, no one is left behind, unquote, and has been promoting the universal health coverage from this perspective. UNDP launched high-level panel for new generation of human security in May. And this is the challenge to create new and wider interdisciplinary approaches focusing on people. And in recent response to the COVID-19, the degree of universal health coverage, such as preparedness and the access to healthcare services, was shown to have an impact on the spread of infection and mortality. Strengthening UHC is essential to ensure the provision of and access to healthcare services in situations such pandemic, where large-scale response funds are needed. In this respect, I have long been advocating for collaboration between health and finance ministers at the country level, and WHO and World Bank at the global level in G7 and G20. This is exactly what I mean by, quote, solidarity is not a positive rhetoric. It is a necessary condition, unquote. The third, the report points out the need for a sense of trust among different stakeholders in order to foster solidarity. The importance of transparent discussion between academia and policymakers, interdisciplinary approaches, including economics and epidemiology, and the policy making based on the scientific knowledge was suggested in the case of COVID-19 control. In addition, the quality of communication was decisive in conveying the policy information to students in an appropriate manner. The forthcoming Tokyo Olympic and the Paralympic is a symbolic opportunity to embody the balance between infectious disease control and economic and social activities. To this point, the various lessons have been learned through trial and error in a situation unprecedented in the world. It is also an important task to subliminate and establish these lessons as an academic field. This is also important as a basis for creating new rules, such as a pandemic treaty, and rebuilding the governance of global health for the post-COVID era. Thank you very much.
Thank you very much indeed, Keiso. And it's definitely the case that the case for UHC has never, ever been stronger. And it really is commendable how the Japanese government have been championing universal health coverage over recent years. Unfortunate that, this hasn't been followed up by all G7 nations. And, but maybe we'll see a change in that. And certainly the point you emphasize about the failures of the G7 and G20 as structures, something that we very much picked up on. And after the recent G7, you've even had people like Professor Jeffrey Sachs questioning the point of the G7 if it can't be more effective during a global pandemic like this. So clearly the baton has been passed to the G20 now, and one's hoping for much better in yes. November. Now, Mariangela, you've been right at the front line of all this, and we've already touched upon sort of issues around trips and access to vaccines. I'm sure you've got a lot to say on this topic of solidarity in sort of working with COVAX and the like. So please do share your experiences with us.
Thank you very much, Robert. And first of all, let me congratulate you all for the excellent report. I see that some of the authors are online. It's touching on fundamental issues for this pandemic and also for future ones. And I will focus, of course, on the vaccine, because this is the most serious problem we have in terms of equitable access to health products. And very much in line with what the report outlines, we see that solidarity in the current context has many faces. We have the combined good sides of it, combined the efforts of the research institutions, early sharing of genome sequences, and just beautifully described by the first speaker, by Mirai, on the community-led efforts to minimize the impact on people's life. And we have the ugly side of it, which is like this blatant vaccine nationalism, the unjustifiable inequity in access to vaccines, which include the emergency of an extremely profitable business for some of the producers, that does not help the equity cause. It comes at a time when the world needs more solidarity and more thinking about sharing and making sure that everyone is protected. And at the time when we're seeing high figures as profit from some of the vaccine producers. And on Monday, you know that twice a week, WHO does have a press conference. On Monday, Dr. Tedros made a very blatant statement about responding, having to move from greed to concrete solidarity and enlightened self-interest. And we are hearing many statements and commitments being made by different stakeholders. Some were already mentioned, all very welcome, and some become concrete, and others so far have not gone beyond words. Dr. Tedros has said repeatedly that solidarity should not be seen as charity. It should never be seen as charity, right? Because self-interest is expected to be part of the equation. That's how humanity works. But in the current pandemic and probably in the future ones, it's also a matter of us thinking of self-interest as enlightened self-interest, because it won't be over until it's over everywhere. And solidarity as expressed in enlightened self-interest, like Professor Kezo just said, it's a necessary condition, right? So we're not talking about choices. We need that, right? WHO is also very much saying that we are facing a two-track pandemic that's fueled by inequity, because we have on one side the ones that have and the others who have not. Those who have had access to vaccines feel they are protected, which is a very risky situation. And among those who have not have access to vaccine, we have severe disease and preventable deaths increasing as vulnerable groups have yet to receive any vaccine. And why does WHO keep beating the drum that it's very risky to relax and feel complacent? And a colleague of mine did a tweet that raised waves and waves because she was watching the games, and she was just, so concerned about the number of people not protected in the games, right? First, because the pandemic's not over until it's over everywhere, although the vaccination coverage is high in some countries, but globally it's very uneven, and it's uneven within countries and between countries. Also because for the fourth week in a row, we are seeing an increasing number of cases, including in the continent I live in right now, it's Europe, right? And after 10 weeks of decline, we see increases in deaths. And the third, it's because of the variants, because the Delta variant is spreading very quickly. It's driving a new spike in cases, even in countries with higher vaccination coverage. And we are still at the process of where science is still assessing the impacts that the variants will have on vaccine effectiveness. But we know something already. We know that the continued unchecked community transmission is the right environment for the appearance of variants. And at the times right now, when we have millions of healthcare workers who have not yet been vaccinated in many countries, we are hearing about some countries with higher vaccination coverage planning to do booster shots in the coming months. And this is not even proven to be necessary by science. So the world needs to get the priorities right from a moral and an ethical perspective. We must be able to vaccinate those who have received no doses and protection. And of course, we very much welcome the tens of millions of vaccine donations. And Japan is a country that's donating through COVAX facility, but we need more, and we need them faster. I think it was mentioned also already, Robert, you mentioned that solidarity can be expressed in high-level decisions, the G7, the G20, the recent G20 finance ministers recognized the importance of funding the ACT-A to ensure that health products are shared, distributed equitably, but we hope this translates in quickly filling the $16 billion gap that we have. So far, the efforts to expand vaccine manufacturing capacity have fallen short. We have a huge push for industry to share public health-oriented licenses, know-how, and technology, but we have received limited response so far. We have the COVID Technology Access Pool about CTAP, and we have the Vaccine Manufacturer Task Force, and we're struggling to get this platforms moving because of the lack of interest of industry in engaging in. Of course, we do have good examples, and the AstraZeneca is, with their bilateral agreements, is a good example because it has helped to increase manufacturing capacity globally quite quickly, and Japan manufacturing of AstraZeneca is a good example, even if the production itself from AstraZeneca is not yet stabilized. And it was already mentioned too that we are all watching the ongoing negotiations on the patent waiver at the TRIPS Council. There are interesting alliances being formed, and I think there's a meeting of the TRIPS Council happening today. Now, in the report, you structure a question on how do we strengthen solidarity in the future? And I find it difficult to envisage how we turn solidarity, quote, right, into a norm, because we need to move it from being the right thing to do, which it is, right? It's the right thing to do it, but it's very much based on the moral ground. And we need to move it to a more organized norm setting, like was already mentioned, the framework for the Tobacco Convention, but WHO is working with member states for a pandemic treaty, right, where the goodwill can be turned into norms and procedures that countries and stakeholders have to follow. So let's see how this discussion will evolve in November. And I remain, to finalize, I remain hopeful that we win this pandemic because we are all working together and we are doing the right things. But I must say, the situation we are living through right now reminds me very much of an old Caribbean saying, where it was that when all is said and done, let us have more done than said. And the academics who will write the history or are writing the history of how we handle this pandemic, I hope that when we finally end it, that we'll see more done than said. So let's keep working hard, and thank you very much for the Chatham House for organizing this seminar. This is a very good time as we are in the next month setting the foundations for the discussion on the pandemic treaty. Thank you, Robert.
Thank you very much indeed, Marija. And we are very keen to help ensure that what gets said actually gets done. And this is the whole purpose of this work, to sort of very much sort of try and bring around sort of policy change. If I could just maybe sneak in one quick question, please, because you mentioned CTAP, and this is strikes a lot of people as a very sensible solidarity mechanism that was initially suggested by the government of Costa Rica, but has sort of had a bit of a bumpy ride so far. Do you see there being sort of increased support for CTAP from nation states, but also maybe even some industry sort of joining? Because I think that's been the problem so far, hasn't it? There has been very little interest from the industry side.
I don't know. We continue to. From the government side, we're seeing more governments coming in support. So this is really good. But we do need. When we've seen, Robert, we've seen interest, for example, from the diagnostic companies. There are 5 projects being discussed right as we speak. Right, we've seen a few from the vaccine manufacturer. They're still starting, but the real push for industry to come. What are the right incentives? We had several dialogues with industry stakeholders, with civil society, with member states, but still the hardcore, to come and put the new technologies into a pool, right? Or a licensing pool, or sharing this technology on a transparent platform. It's still a big challenge for us all. And just let me just say that next week we are organizing actually a dialogue together with WHO and WTO, and it will be focusing on financing, the licensing, and the technology transfer, bringing industry and member states into a firm dialogue. How do we make this work for the world, right? Not for individual companies or for individual countries.
Brilliant. Thank you. And I've already seen some questions coming in around WTO, and very much encourage participants to ask your questions now. Top tip: ask your questions early, because the moment others start asking, that it's bound to be the case that they'll miss out unless you ask your question nice and early, and then it can get upvoted. But if I may come to David now, David, you've been very much part of the science and the scientific solidarity. Interested to get your perspective. So sort of how that's worked, and your sort of feelings about how the politicians have perhaps not followed up on the solidarity of the scientists.
Thanks very much, Rob. It's been a real pleasure to read the report that you've developed. It's clear, and it clearly shows the successes and the failures, and that's been supplemented by the excellent panelists who have presented up till now the views that they have. I've had a rather privileged position in all this because I've been chairing a group at WHO that's advising the emergencies program on the COVID-19 response. And I really can say that, as you've pointed out in the report, and as has been pointed out by my fellow panelists, it's been a great success in both the scientific community and the technical community in being able to work together, share transparency, and develop the guidelines, the guidance, whether it's been precautionary or evidence-based, that has really helped countries face the fact that this disease is becoming endemic and dealing with it until that period of time when there's a better equilibrium between the virus and the human populations. So there have been some successes, and some great successes. Rather than, though, looking at the failures, I'd like to rather look forward at the need for solidarity in many different ways. And there certainly is a need moving forward for solidarity at the global level when there is a pandemic, in order that there can be a safety net, so that when countries can't do the job they need to be doing, there's a way that they can work with technical collaborators, and also with scientific and technical collaborators, and collaborators in providing vaccines, diagnostics, and therapeutics, as is occurring with the ACT Accelerator. Very new innovation, very important innovation in making more equitable distribution. And that needs to be supported moving forward as it becomes something which will probably be dealing also with the inter-epidemic period in providing for more equitable access to the tools that we need to be better prepared. But the focus has to be mostly now on the national level, on making sure that countries can rapidly detect and respond to outbreaks when they occur, so that they don't spread internationally, so that they don't spread and become pandemics. And this requires three things in my view, and in the view of a recent Lancet commission that I've been chairing. And that includes strong public health, access to robust health systems, and enabling healthy lifestyles so that people are healthy. So if we have robust health facilities, good public health that can do contact tracing and surveillance, and enabled better lifestyles, we can deal better with pandemics and epidemics moving forward. Now, there are some partnerships that have been working on part of this. For example, the Global Health Security Agenda is a partnership, as you know, among over 70 countries, and they work together to assess each other's capacities, and then they develop work plans based on their gaps in capacity to strengthen their capacities. The failure in this has been that the countries in the North that are partnering in this partnership have not really provided the funding necessary to meet national investments in their public health, in their IHR capacities, and therefore the international health regulation capacities in a treaty have been neglected. At the same time, there need to be new partnerships, or some of the partnerships existing, to strengthen access to robust health systems and also enabling healthy lifestyles. We need to show each other how we can move together, understanding that it's the national focus and even subnational and community, which is the most important in order to prevent international spread. So hopefully we'll have that national focus while at the same time developing the global solidarity to make sure that there's more equitable distribution of goods necessary for preparedness, and when pandemics occur. So thanks, Rob. Again, congratulations on a great report, and thanks to my fellow panelists for some really interesting observations.
Thank you very much, David. And I think very important the point you're making about sort of integrating these issues around health security, health systems, and healthy lifestyles. I mean, that's very much the focus of WHO's global program of work, isn't it? To integrate those things together. And one can see that a lot of reviews are sort of saying that we need to be sort of combining the agendas of health security and universal health coverage, but with this sort of focus on improving healthy lifestyles as well. So thanks very much indeed for that, David. So now we are on to a question and answer time, and I'm delighted to see questions sort of pouring in, and very much encourage colleagues to upvote the ones that they like the most, and we can see that is already happening. I'm just wondering, Frini, if a couple of our participants might like to come on air, as it were. Gasego and Amrita, I think in particular we've identified. Are they? Yeah, great, fantastic. So Gasego, would you like to ask your question of the panel?
Yes, thank you. Thank you for this presentation. I think it is very enlightening. My question is, if solidarity means involving all the stakeholders, we know that WTO is one of the fundamental players in this scene. And the WTO has for a very long time refused to use the language of human rights in dealing with situations that are clearly human rights violations or have the potential to violate human rights. The pandemic brings to the surface the right to health and the right to life, which are protected in international human rights instruments. Is it not time for the WTO to use this as an opportunity to bridge the gap now between trade and human rights by just using the language of human rights? Because that is what we are dealing with.
Great question, Gasego. And I'm not sure if you might have seen the article that Mary Robinson wrote in Project Syndicate today, very much around needing to take much more of a human rights approach to the pandemic. But perhaps this hasn't been the case in WTO. Mariangela, I guess you'll be the best position to speak on this, but please, other panelists, sort of chip in as well. What's your thought on these discussions at WTO using more of a human rights perspective?
Yeah, first of all, I don't know about WTO avoiding the human rights language, Gasego, so I'm not really familiar with what you're saying, but I would say that the Doha Declaration on TRIPS and public health was very much focusing on increasing access and very much trying to include flexibilities to the IP legislation, and therefore include flexibilities that would allow countries more maneuverability to address the public health interests. So that's one side that I know. So bridging the gap between trade and human rights, I'm not quite sure how to do that. But I must say that we do, during this pandemic, have been working very relentlessly, especially now with Dr. Ngozi at the front. Dr. Ngozi, the new WTO executive director, used to be the Gavi chair, the Global Vaccine Alliance chair, and she's been working with WHO. She was the chair of the ACT. She was with a special envoy for the DG on the Act A. So she's very much bridging what a very much needed gap between trade and health. Right? That's we've been doing for years and years, maybe 10 years, a trilateral cooperation between WTO, WIPO, and WHO, but we've seen renewed interest during this pandemic and bringing down like trade barriers on the export bans, and for the free circulation of products that are important for the world. But I wouldn't know how to address specifically the issue of human rights and trade because I'm not familiar with that part.
Do other panelists have a view about sort of using the human rights language more with perhaps not only WTO, but you know, thinking of the likes of IMF and World Bank as well? Keizo, do you have a view on the usefulness of using the human rights language?
Yes, this is actually very sensitive issues, as you know, that the human rights approaches is a very fundamental approaches. However, sometimes those are the strong voice of the human rights can be utilized for another political purposes to accuse the other countries. And in this context, for example, that recently in China, in some province, used the prisoners to produce some products. And some other countries, the human rights approach strongly argue that we should not import the product produced by the prisoners in a fair manner. And that sort of sensitive issue sometimes coming up under the conflict, the geopolitical conflicts, such as the US and China. You know, that I quite agree with those of the human rights approaches in this manner. However, we should be very careful to use those approach, not invite and exaggerate those the negative responses and accelerate the conflicts rather than the cooperation. Thank you.
Very helpful, very interesting. Thanks very much, Keizo. So now, if I can maybe ask Amrita to ask the next question, please. And I'm glad to see that you're on the panel. So Amrita, would you like to even come on screen and ask your question?
Thank you, Robert. Hi, everybody. That's been fantastic to hear from all the speakers. Really enjoyed it. So my question comes from, so I'm somebody who was a surgeon that has transferred careers and moved to the environment sector, motivated by the climate emergency. So it's been an interesting year watching how the health crisis of the COVID-19 pandemic sort of has obviously exposed the ugly underbelly of vast inequalities that still affect much of our world today. My question is around what lessons in solidarity can we transfer from the COVID-19 pandemic to tackling the big dual global emergencies of the climate and biodiversity crisis?
Great question. Thanks very much indeed, Amrita. Who would like to sort of volunteer to kick off on that? I'm just wondering, Mirai, yeah, fantastic. Thank you.
So thanks a lot, Amrita, for your question. Great question, as Rob said. And at the risk of repeating myself, I think whether it's the pandemic, other natural or human disasters, and indeed the climate crisis, I think the place to start or where we should put people is right in the center, particularly local people, as I've been stressing. I think that if, I don't mean to sound simplistic, but if we do listen and go to local people, there are lessons from every country. And as I mentioned, particularly those who live on this earth lightly, who are often traditional communities, indigenous communities, the forgotten communities, the most vulnerable and marginal. Oftentimes we find answers from them if we care to listen, especially on the issues that you mentioned, biodiversity and how to live lightly. I think one of the lessons of this pandemic is the power of solidarity and local leadership, particularly those who are usually marginalized, like women, in my experience. In India, anyway, it was women, frontline workers. I don't mean those in like nurses and doctors and hospitals, those of course, but I mean those right at the grassroots level who put others, as I said before, themselves. And I think that there are lessons in that, lessons in collectivization. So we maximize our resources, we use our resources with wisdom, with caution, and with care to Mother Earth as well. And the other great lesson is also I think for all of us in all countries, how to simplify our lives. We have been forced to simplify our lives. There's been no choice. You know, I don't know how it is in the richer countries, but in the poorer countries, you know, people have really cut down. I mean, they shouldn't cut down on food and things, but other things, you know, marriages and ceremonies and so on have simplified greatly. So how to live our lives in a simpler way and closer to the earth, I think we have been forced to rethink and reconsider, reflect, and challenge ourselves individually and as communities. Thank you.
Excellent. Thank you very much indeed. Right, extremely comprehensive. Just wondering if any of the panelists like to take this up. David.
Yeah, thanks, Rob. Yeah, I think Mireille is right that there are many examples of what's going on. And what's happening is that there are many scientific publications coming out now which show what the impact of the slower travel and trade has been as far as on the environment and also on biodiversity. There have been many publications coming out, and those will create a base of evidence that's necessary moving forward. And they should also be used as we continue to advocate for more attention to climate change and to biodiversity moving forward.
Fantastic. Thanks very much, David. And I think one of our overall sort of findings really has been that, you know, faced with an existential threat like COVID has been, one certainly can't take solidarity for granted. You would like to think that, you know, people would take a whole of humanity perspective and you would see the world rally round, but that hasn't happened. So you know, I think we need to you know, wise up to that when addressing these other major threats. Right, so next I've got on my list Giuliano Russo, please.
Hi, Rob. Hi, everyone. Giuliano Russo from Queen Mary University of London. I really liked what Dr. Mariangela said about solidarity that should never be charity. But I was wondering whether, rather than relying on the goodwill of rich countries to donate vaccines, excess vaccines to COVAX, we should really focus on spurring and increasing the domestic capacity of certain low and middle income countries to produce vaccines. Not all the stages of pharmaceutical productions are feasible in low and middle income countries, but certainly certain stages like manufacturing are. And you know, countries like Brazil, but also South Africa have demonstrated in the past that they can definitely increase their local manufacturing capacity, like India as well, and increase access to vaccines and pharmaceuticals. Thank you.
Yeah, Mariangela, if you'd like to kick off with that, and I'm interested to get Mari's perspective on this from India as well. So, but Mariangela, perhaps if you can kick off.
Yes, let me start. Thank you, Juliana. I think it's a great point that you make, because we cannot only, we do need to do things at the same time, right? Because increasing local production capacity is a mid to long term, right? It's something that needs to, and we see that WHO, the World Health Assembly, has just approved a local production resolution now in May. You know, we saw increased interest in investing in local production, not only for the global security kind of thing, but for national security reasons as well. But this takes time. It requires technology transfer. It requires investments. So there are several pieces on the local production where it worked. There are reasons why it worked. Where it did not work, we know the reasons why it did not work. So WHO has, and COVAX has a vaccine manufacturing task force ongoing. WHO has issued an expression of interest for the organization of tech hubs, technology hubs for the mRNA vaccines. No, so this is work in progress. At the same time, Giuliano, we need to ensure that countries can access vaccines existing now. You know, so the COVAX facility aims to do that, you know, to make sure that not every country in the world had to go out there and fight for a contract. You know, so this is like a consortium. It's a mechanism, a global mechanism. It's not a charitable mechanism. You know, it's funded by self-financing countries, and it has a list of countries that receive vaccines because of the Gavi mechanism. So we need both things. We need vaccines to come through COVAX. Some of them are coming through donations right now, but the majority of them come through the contracts that COVAX has. It's Gavi, WHO, CEPI, and UNICEF. And we need to increase vaccine manufacturing capacity because we are not over this. This is, I think, the third coronavirus problem we have at least in my professional lifetime. So it's not going to be the last before I die. So we need to be sharper for the next pandemic as well. But a very good point. Thank you.
Mm-hmm. Am I right that India has been pushing hard for greater sort of manufacturing and tech transfers to developing countries? What's your perspective on this issue?
So first of all, I agree with Mariangela that it's both. Obviously, in the long term, we would like to see more countries move towards self-sufficiency in vaccine, mine India being one of them, rather than a monopoly in some countries. And you will recall, Rob, when we were working on universal health coverage for India and you were part of our consultations, one of the strong recommendations we gave to the government of India, which was in 2010, mind you, 11 years ago, was to strengthen and upgrade vaccine facility in country capacity, which India actually, we're fortunate we have. We're supposed to be the pharmacopoeia of the world and also a big vaccine hub, but that didn't happen. And I think now collectively as a nation, we are understanding that was not a correct choice, perhaps even a foolish gap that was left. And we do have the Serum Institute, but as everyone knows, it's a private business. It's not, a state or it's not a government enterprise. So yes, I agree with Mariangela, and I also agree with the spirit of the question that we need to move towards vaccine self-sufficiency in many other countries. And it shouldn't just be a monopoly of India or Serum Institute or anybody. More decentralized, so we can get it quickly where it needs to be. But obviously, it has to be technically sound and the capacity has to be there. And that will take time for many countries, including my own.
Great, thank you. And Kesa, I can see you want to come on this this topic as well.
Yes, of course that we should know that the vaccines become a real global health public goods, and we should strengthen the suppliers' capacity to develop and allocate. But in addition to develop and allocate, we should have more harmonized the authority of the regulation of the new drugs and vaccines. In this context, recently, very unique the tendencies happened for the ICUMRA. ICUMRA is the international regulation of the authorization of new drug. This has now the task force. Nearly 30 countries participate and create the drug regulation system under the emergency. For example, now, the Japanese manufacturing now develop the vaccines. But we have already consumed the first and the second phase. But we cannot enter into the third phase of the clinical trial because of the existence of the Pfizer's and Moderna's and other existing vaccines. Therefore, ethical problem come out when we have such a third phase in the original manner. Mm-hmm. Therefore, now ICUMRA has a task force to examine how we can shorten the regulation of the third phase under the emergency. You can imagine we had already had, so many serious battles how to harmonize the regulation of authorization on drugs. It was a really zigzag course in the past, but within such a short period, 6 months, now that we can accelerate though the process of harmonization for the drug regulation, especially for the third phase of the clinical trial. This is the very concrete, the process of the solidarity.
Mm-hmm.
So, and this is the meaning of the solidarity. Solidarity is not a charity. This is the real, closely related to each interest of even the manufacturing company.
Mm-hmm.
But how we can design the different motives and different incentives of the many different stakeholders to join in and create more the scheme of the function to regulate the vaccines under the emergency. This is the wonderful occasion of us. Therefore, I would like to use the word of the solidarity in this context in a real productive manner. Thank you very much.
Yes, and I think it's something that a number of you are mentioning, to turn the language of solidarity away from sort of charity and do-gooding to more around, as Mariangela was saying, enlightened self-interest. And I think that goes for the public and private sectors as well, just like you're describing. I've just noticed there's a huge rush of questions coming, which often happens coming to the top of the hour. So I do apologise that we're only going to be able to take one more. And I'd like to bring in Martin Drury, please, who's been waiting very patiently. And I think it's got a very topical question around aid. I'd say it's topical, here in the UK, with our Parliament just having voted to slash aid funding yesterday. So Martin, would you like to pose your question to the audience?
Hello, Rob, and thank you so much, everyone. Yeah, so this is a question, it picks up really on what's just been talked about, which is that solidarity is different to charity. And I think politically that gets undermined so much in terms of impact because of the profile and strength of the aid narrative. So the solidarity contributions, it's not aid, and it's not charity, but in the public mind, it so readily defaults to feel like aid, and that therefore makes it very easy for leaders like Boris Johnson to resist the solidarity contributions. So my question is, do we need to stop using the word aid and develop a new language, a new narrative to replace aid when describing that funding and making the case for it?
Great question, Martin. To make this sort of solidarity work, do we need to be sort of, changing the mindset to people and using different terminology? Just wondering who might pick that up. David, do you want to kick off with that? Thanks.
Yeah, I'll just say a word, Rob, about a transfer of technology that I was involved in back in the early 2000s, which was to get a vaccine at US 50 cents per dose for use in sub-Saharan Africa during epidemics of meningitis. That vaccine became available at 50 cents a dose, yet no country was willing to buy it. They waited for Gavi to provide it to them. And so my message is that it's not only the North that should be providing to the South, but it's the South as well that must be matching that or showing an effort to really deliver the goods to their people and to get those goods into their countries. This can be done in many ways, but I think what's very important is, I like Martin's idea about aid, because it's maybe not aid, it's maybe co-financing is what we're doing, because we want to help countries in co-financing what they need to do moving forward in procuring goods and also in pandemics. And I think that agrees with what Mariangela said as well earlier. Maybe she'd say a word after that, Rob.
I say, Mariangela, what do you think?
No, very, very quickly. We're almost at the hour, but I hear you, David, and thank you, Martin. I am Brazilian, right? So I've been Brazilian more time than I've been in the UN, right? Because I lived most of my professional life was in Brazil, and I always had a problem with the language. When you have like donors and recipients language, right? If you're donating something, you can set the rules. I used to call it like a neo-colonialism, where you're setting the rules, and someone who's receiving it is a very, how do you say it? It's like a transaction where one is above and the other has to be grateful for what they receive. So I think it's a very welcome discussion, especially as we lead through this period where we need to turn solidarity into something more concrete in global terms. It's a very welcome discussion regarding the language around aid. It's not only the language. I hear what Martin is saying. It goes beyond the language. That's my quick comment.
Yeah, Mariah, please. Yeah.
Yeah, just very quickly. I know we're almost at the hour. I mean, I think the spirit, I agree with what Mariangela and David have said. I think the spirit should be the spirit of partnership. Everyone brings something to the table. So do local people, as I've been stressing, and communities who have solutions, who have tried and tested things. So I think it's about partnerships, and I agree with Mariangela that oftentimes the aid comes with all kinds of strings attached, and even if not, all kinds of inflexibilities. I mean, we also deal with donors and the kinds of things that come and the attitudes. I think I agree with David that it's not north and south. All of us need to re-examine, reflect, and change so that it's more in the spirit of partnership rather than, this kind of donor and recipient passive relationship. It should be an active, dynamic partnership.
Yeah, fantastic. I think a great way to sum it up there, Mariah. And what's really interesting as well, I think this is very relevant to the debate around universal health coverage as well, because at the end of the day, moving towards universal health coverage is predominantly around domestic financing and the not so much aid financing, but governments sort of taking responsibility for financing their own health systems, as David was alluding to, and suddenly putting in big increases in public financing to cover their entire populations. And what's very interesting, and some research that I think we want to work on in the future, is looking at that so many of the world's great universal health systems have actually come out of crises. If you look at United States and Japan, Keizo, I've heard you speak many times before about the UHC system in Japan coming out of the Second World War and it being fundamental to Japan's development. France and Italy, these are all sort of countries that their universal health systems have come out of crises. But more recently, countries like Thailand and Rwanda have launched UHC reforms coming out of crisis. And so, one thing that we're very interested in looking at is the potential for this crisis to trigger UHC reforms in other countries. And we're already seeing some indications of it in countries like South Africa. I'd be interested to get your take sometime, Mariah, on the potential for resurrecting this in India. But maybe looking forward, this can be a very good example where, perhaps our countries as well that have used our crises to launch UHC reforms can support countries going through this process into the future. And it's an area that we're very keen to work on in the future with you all and with the audience watching as well. But for the time being, I've noticed that we've just gone slightly over the hour. I must thank our panel for an absolute fascinating discussion. I for one, have really loved it. Apologies for the participants who didn't get their questions answered, this time round. But I hope you've enjoyed it, and we look forward to working with you and ensuring true solidarity in getting out of this crisis and avoiding future ones as well. So thanks very much indeed for joining us today. Goodbye.